So this is a wonderful schematic diagram now that's about 10 years old that sort of shows the progression towards Alzheimer's disease. So on the horizontal axis, this is time. And I put two markings here. The time when an individual would go from being preclinical to a neurologist or geriatrician might give them a diagnosis of mild cognitive impairment. And then this second line would be when the clinician would switch the diagnosis now to Alzheimer's or dementia. And if we look at the pattern of changes in the brain over time, before and after these diagnostic signposts, there's important things I want to show you here. So first of all, when we look at the molecules in the cerebrospinal fluid that are going abnormal, the beta oligomers, tau, those molecules are changing and their levels are increasing well in advance of any clinical diagnosis. This, we believe, is the earliest part of the disease process. And it could be happening 20 or 30 years before the clinical diagnosis. And those proteins that are accumulating and those abnormalities are starting to attack neurons. They're leading to sick brain cells and synapses that are disintegrating. And so synapses are starting to be lost here. Still, before the earliest clinical diagnosis takes place. And the loss of these synapses is going to have an effect on the networks in the brain so that the functional connectivity will start to change. Again, the earliest change is happening before any clinical diagnosis. And finally, all of those changes will lead now to behavioral changes where the patient or the individual might have learning or memory deficits or executive function deficits. And that's what's allowing the clinicians to make these diagnoses. But by the time the clinicians make these diagnoses, a tremendous amount of brain pathology has taken place. And so wouldn't it be great if we could go back here and find the earliest biomarkers in the cerebrospinal fluid or the blood so that we could alter the trajectory of these disease processes? That's really the goal of ONDRI and all the neuroscientists working on neurodegenerative diseases.